Hello everyone, welcome to this recorded lecture. This lecture will be going over chapters 1 through 4, the Evolve textbook, Introduction to Pharmacology. LPNs play a very important role in the nursing process with drug administration. The need for a well-educated LPN workforce is predicted to grow even faster than the average rate for all other occupations right now. LPNs practice in nursing homes, assisted living facilities, outpatient clinics, home health agencies, psychiatric behavioral health facilities, hospices, rehabilitation centers, and other settings. Wherever the LPN will choose to practice, it is likely that drug administration will be a significant part of the role. Let's review the nursing process. We know that this consists of 5 major steps: assessment, diagnosis, planning, implementation, and evaluation. Assessment is the first step of our nursing process, and it involves collecting important information. The RN is typically assigned as the staff member who will perform the initial full assessment for each patient. As an LPN, you will often make vital contributions to this assessment. The first part of the assessment related to drug administration will involve gathering information about the patient and their health conditions before you give any drugs. When the patient is admitting to a healthcare setting, you can obtain this information by talking to your patient or to their family members. Information in the patient's history will often direct the nurse and the physician to look for certain physical signs of illness that may be present. Of course, we're going to collect our subjective and objective data. This will be a review. We know that information is subjective if you have to rely on the patient's words or if the symptoms cannot be felt by anyone other than the patient. And objective data is data that can be seen, heard, felt, or measured by someone other than the patient. The RN typically conducts a comprehensive physical assessment. As an LPN, it's important for you to assess vital signs, physical findings based on careful observation, auscultation, and light palpation as appropriate for your clinical setting and according to your State Nurse Practice Act. It is especially important to gather subjective and objective assessment data when the patient is first seen or on admission to the healthcare setting. This initial information can be used later on as a baseline to compare care progress. Much of your role in the assessment may be reporting data that you collect to the RN or other members of the healthcare team. The baseline nursing assessment will be conducted at the time of the patient's admission to the healthcare setting. The most important part of this assessment will be the drug history. When asking patients about their drug history, we will want to collect data in the following areas: symptoms, signs, or diseases that explain the patient's need for a drug, like high blood glucose levels, high blood pressure, or pain. The names and, when possible, dosages of all drugs that the patient is taking. Make sure to include prescription drugs, over-the-counter drugs, alcohol or street drugs, and alternative therapies like herbal agents or nutritional supplements. Include any problems that the patient has had with any drug therapy, for example, allergies and diseases that may prohibit or limit the use of some drugs. The physician will decide on the medical diagnosis, and the RN determines the nursing diagnosis. When you are giving medications, we want to ask some follow-up questions. Some follow-up questions you can ask are: what are the major health-related problems of this patient? What kind of drugs is the patient likely to require? What special knowledge or equipment will be required to give these drugs? What special concerns or cultural beliefs does the patient have? How much does this patient understand about the treatment and drugs prescribed to them? and what factors will affect the patient's ability to care for themselves. When forming our plan of care, it will involve collaboration with nurses and the patients or caregivers. After a drug is ordered, the nurse needs to verify that the order is accurate. This is usually done by checking the drug administration record or the electronic medical record against the original order. No part of the order or the reason for giving the drug should be unclear. Any questions about whether the drug is appropriate or safe for that patient needs to be answered before that drug is given. If you think there's a problem with the drug order and the provider cannot be contacted or does not change the order under question, notify your charge nurse and nursing supervisor as quickly as possible. Planning to give a drug will involve 4 important steps. First, know the reason that you are giving this drug to the patient. Why? What is it going to do for them? Learn specific information about the drug, including the action of the drug, negative side effects that can develop, the typical dosage, route, and frequency, situations in which the drug should not be given, which are contraindications, and main drug interactions. Plan for special storage requirements, procedures, techniques, or equipment needs. Does the solution need to be shaken before it's given? Should the drug be refrigerated? Do you need a specific syringe, like an insulin syringe? What special techniques are necessary for giving the drug, like using an inhaler or not applying pressure to the site after giving certain injectable drugs? And finally, develop a teaching plan for your patient, including what the patient needs to know about the drug's action and its side effects, what the patient needs to know about taking the drug correctly, and what the patient needs to report to the nurse or physician if they start to develop any problems. The planning step of the nursing process is also the time to gather any special equipment that you will need to give the drug and review any special procedures that you will need to do to give the drug appropriately, like the Z-track technique when giving an IM injection. In planning the patient's care, we learned why each drug was ordered, the drug's actions, and how to safely give the drug. Now, when we implement, we will use the information that we learned and actually give the medication. When we do this, we want to consider, of course, the 9 rights of drug administration. These can be seen on page 5 in chapter 1. Notice that there are 9 rights included here and that we've typically been studying the 6 rights. Well, you'll see the 3 extra ones at the bottom there. Right reason, right documentation, right response, and right to refuse. We use the right documentation to record that the dose has been given. We then monitor the patient to assess for the right response. The final reason is that the final right is that the patients have the right to refuse the drug. Before you give any drug, make sure you identify the right patient. To properly identify the patient, you need to use 2 identifiers. Healthcare agencies can specify the main identifiers to be used in the setting and/or use a barcode system to scan the drug to the wristband. Best practice is to directly ask the patient, "Tell me your full name." This is much safer than asking the patient, "Are you Joe Jones?" A patient who is confused may not understand this question and might just say yes or no, regardless of whether or not that's actually their name. In the hospital setting, never give a drug to a patient who is not wearing a wristband. Make sure that you contact somebody, administration or registration, and you obtain that wristband before you give it. Ensure that you have the right drug. Carefully compare the drug order with the drug label. Do this 3 times. Make sure that the drug is in the correct form prescribed because some drugs can come in multiple forms, like tablets, capsules, or syrup. Drugs can come individually wrapped in a unit dose system package or as a prescription filled for one person. In rare cases, they may be taken from the unit's stock drugs. The drug order should say when and how often the drug is to be given. If you have any questions, make sure to notify the RN or healthcare provider. It is always better to ask the question than risk a mistake. Hey, stop it. If you have any questions, make sure to notify the RN or healthcare provider. It is always better to ask the question than risk a mistake. I just said that. To be effective, many drugs must be given exactly on schedule, day and night, to keep the level of the drug constant in the body. Drugs are usually given when there is the best chance for the body to absorb them and the least risk of side effects. When a patient is taking several drugs, be sure to check to ensure that these drugs do not interfere or interact with each other. It can be especially important to confirm the timing of one-time only, as needed, and emergency drugs. The nurse needs to be certain that nobody else has already given this drug and that it is the appropriate time to give the drug. Never leave a drug at the patient's bedside for them to take later. Always actually stand there and wait for them to physically swallow it. As a nurse, you must document the time that the patient actually takes the drug. If you're not present when the patient takes the drug, then you cannot document it. Making sure that we have the right dose. That's a lot of what our dosage and calculation purpose comes into. Pediatric patients will typically have doses ordered based on how much they weigh. The drug order needs to state how the drug is to be given. This is the route of administration. The oral route is the preferred route if the patient is oriented and can swallow without choking. For patients with breathing problems like asthma, drugs that were previously given orally can now be given by an inhaler. Record the time, route, and site of administration after you have given the drug. Any patient reports of problems or adverse effects must be noted in the chart and reported immediately to the head nurse and the physician. It is vitally important that you never record drugs that were not given and never record drugs before they are given. If an error is made, talk about it honestly and take quick action to correct any damage. This is vitally important to protect the patient from harm. Although we do recognize that patients have the right to refuse, it is always important to talk with the patient regarding his or her reasons for refusal. Remember, first listen, then ask questions, then get your next resource. Call the provider or your charge nurse. Evaluation is the appraisal of the treatment's effectiveness. Evaluation of what happens when you give a drug will help the healthcare team decide whether or not to continue that same drug or make a change. The nurse will check for 3 types of responses to drug therapy: therapeutic effects, expected side effects, and adverse effects. Therapeutic effects are seen when the drug does what it's supposed to do. Expected side effects are typically mild and do not require the drug to be stopped. Always make sure you document side effects. Adverse effects are typically seen when the patients do not respond to the drugs in a way that they should, and these effects are going to be more severe. If you suspect a patient is having an adverse effect, report it to the RN or healthcare provider immediately. And that's it for chapter 1. We're going to move on to chapter 2. As a nurse, your decisions about drug administration can have legal and ethical consequences. You have an ethical responsibility to inform your patient's care provider, the patient, and the family that you will be giving drugs, especially when you give them mixed in a food or drink. The mixing of drugs with food or drink needs to be documented in the patient's care plan and on the drug administration chart to assess the legal aspect of this practice. It is important to know which types of drugs cannot be crushed or have the capsule opened. Some drugs have a coating that will slow the release of the drug, and crushing those capsules or tablets is not recommended. Drug diversion is defined as the illegal transfer Drug diversion is defined as the illegal transfer of regulated drugs, like narcotics, from a patient for whom they were prescribed to another person, for example, the nurse, to use themselves or others. Whenever drug diversion is suspected, the organization is required to launch a full-scale investigation. Some behaviors that can signal a drug or alcohol dependency problem in a nurse would include increased absences, lateness to work, unexplained disappearances from the assigned unit, and decreased alertness. Nurses who give drugs are required to follow 3 levels of rules: federal laws, which describe rules that control how certain drugs can be given; state laws and regulations, or rules, that specify who can prescribe, dispense, or give drugs and the process to be used; individual, hospital, or agency rules, which can specify other guidelines or policies regarding how and when drugs are given and the records that must be kept recording the drug treatment. Federal laws define 3 drug categories in the United States: controlled substances, which include opioids and some sedatives or tranquilizers; prescription drugs like antibiotics and oral contraceptives; and over-the-counter drugs that are available without a prescription. Most regulations are written for controlled substances because they are often most abused by patients and the general public. Pharmacists will dispense drugs according to the provider's orders. Each state and healthcare agency has laws and policies that cover ordering, receiving, storing, and record keeping of controlled substances. Records must always be kept for every dose given of a controlled substance. Nurses may not borrow a drug ordered for one patient to use for another patient, and they may never use those drugs for themselves. A pattern of drugs frequently being dropped or spilled, or records that show a patient received a large or more frequent dose without pain relief, can serve as clues to possible drug diversion. When controlled substances, particularly opioids or narcotics, are ordered from the pharmacy, they come in single-dose units or pre-filled syringes that are attached to a special inventory sheet. The use of opioids and narcotics is carefully monitored on the hospital unit. Controlled substances are stored in a special locked cabinet. If a dose is ordered that is smaller than the provider ordered, so that some of the drug needs to be discarded or wasted, or the drug is accidentally dropped, contaminated, spilled, or otherwise made unusable or unreturnable, 2 nurses need to sign the inventory report and then describe the situation. The most commonly abused prescription drugs include narcotics and opioids that are drugs given for sleep anxiety disorders. More and more, insurance and government groups that pay for drugs are limiting the types and numbers of drugs that may be ordered for those on a preferred drug list. This may require the use of cheaper generic drugs to control costs. Over-the-counter drugs are safe enough to not need a prescription. Like all drugs, over-the-counter drugs can produce adverse effects in some patients. Studies have shown that 40% of parents give their children incorrect dosages of liquid drugs. It's important to make sure that parents understand how to dose these properly. The drug order will come on a legal prescription. This will generally restrict the prescriptive authority to physicians, dentists, nurse practitioners, nurse midwives, nurse anesthetists, and physician assistants. Providers who write prescriptions are also called prescribers. A legal prescription order must contain the patient's full name, the date, or name of the drug, the route of administration, dose, frequency, duration, and the signature of the prescriber. In emergencies, or if the provider is not available on site, a verbal order, usually over the telephone, may be given. Drug orders are classified into one of the 4 types: the standing order, the emergency or STAT order, the single order, and the as needed or PRN order. The standing drug order indicates that the drug is to be given until it is discontinued or for a certain number of doses. An emergency or stat drug order is a one-time order that must be given immediately. A single drug order is a one-time order to be given at a specified time, for example, before surgery. An as-needed or PRN order is an order for a drug to be given based as needed on the nurse's judgment of safety and patient need. An example of that would be as-needed pain medicine. We know that the Nurse Practice Act of each state will define what and how we can give medications. Nurses will often move between jobs, and some states will recognize the nursing license of another state through an agreement called the Nursing Licensure Compact. Nurses who give drugs to patients do accept professional responsibility for giving these drugs correctly, ethically, and legally. This means that nurses need to accept ethical and legal responsibility for good judgment and actions in drug administration and monitoring the effects of the drugs that they are giving. The nursing process is a helpful system to use when giving drugs. You also teach the patient and the family the information they need to know for continued and safe administration of the drug. One critical nursing responsibility is to check that the drug orders for your patient are correct. Integrated within an EMR, many facilities will now use a barcoded drug administration system to allow the drug orders to be sent to the pharmacy when they are written. The drugs are sent to the patient's room or floor, and the drug is then taken to the patient's bedside. The use of a computer to create the record will prevent illegible clinician handwriting, which is a common cause of drug errors. Another type of drug delivery system is the Pyxis. The Pyxis is an automated drug dispensing system that provides computer-controlled storage, dispensing, and tracking of prescribed drugs. Organizations will pay a financial price for all drug errors that occur. Drug errors can occur at any of the 3 points in the drug administration process: during the drug preparation, bringing the drug to the patient, and giving the drug to the patient. Nurses have an ethical responsibility to report drug errors because of possible harm to the patient. If you suspect that an error was made, immediately check the patient, notify the healthcare provider promptly, and follow any orders the provider gives to reduce the effect of the drug error. Excuse me. If the nurse was careless or negligent, she or he may be held professionally and/or legally liable. High alert drugs are labeled so because of the consequences of the errors are very serious. A high alert drug can cause harm to the patient who receives it in error and to those who receive too high a dose, receive too low a dose, or are not actually prescribed a dose. Common categories for high alert drugs can be remembered using the acronym PINCH. P is for potassium, I is for insulin, N is for narcotics, C is for cancer or chemotherapy drugs, and H is for heparin or any other drug that interferes with blood clotting. The black box warning can be assigned by the FDA. This would mean that the drug has a higher than normal risk for causing serious and even life-threatening problems. Drug reconciliation should be done when the patient is admitted to the facility. This list needs to include all over-the-counter drugs, herbal supplements, or vitamins, and prescription drugs that the patient is taking on a daily basis. Teach the patients to carry their most recent drug list with them and bring it to all healthcare provider appointments and to update that list as any changes are made. And we're moving on to chapter 3. So this chapter is really going to provide an overview of some basic information regarding the chemistry, physics, anatomy, and physiology that helps explain the actions of drugs in the body. Pharmacokinetics is what the body does to the drug. Pharmacodynamics is what the drug does to the body. Pharmacotherapeutics is the use of drugs in the treatment of disease. It's so important to know the different names of drugs so that the wrong drug is not given to the patient. For example, Valium is a trade name, but it's also known as diazepam, which is its generic name. The most common drug name used is the generic name. This is the name the drug manufacturer uses for the drug, and it's the same in all countries. Examples of this would be ibuprofen and acetaminophen. Generic names are not capitalized when they're written. The trade name or brand name is often followed by the symbol R, which indicates that the name is registered to a specific drug maker or owner, and nobody else can use that name for the drug. The first letter of a trade name is capitalized. Examples of trade names include Motrin, Tylenol, and Mylanta. Chemical names are typically difficult to remember because they include all of the chemicals that make up the drug. These names are usually long and hyphenated, and they describe the atomic or molecular structure of the drug. These names do not need to be remembered for safe drug administration. Drugs take part in chemical reactions that change the way the body acts. They do this most commonly when the drug forms a chemical bond at specific sites on the body cells. These are receptor sites. We'll remember that they are small, lock-like areas of cell membranes, and they control what substances enter the cell or change its activity. This chemical reaction between drugs and cells is only possible when the receptor site and the drug can fit together like pieces of a jigsaw puzzle or a key fitting into a lock. Drugs that activate or unlock receptors and have the same actions as the body's own chemicals are known as receptor agonists. The drug morphine is like a key that activates the opiate receptors, a lock, and produces analgesia, pain relief. Some drugs attach to the receptor site but produce only a partial effect. These will be known as partial agonists. Buspar is an example of a partial agonist. Although it can be used alone, it is frequently used to boost the effects of other drugs for depression, such as Prozac, that are full serotonin agonists. When a drug attaches at a drug receptor site but does not activate or unlock it, there is no increase in the cell activity, and this drug is called an antagonist. This antagonist effect will block the action of agonists. By blocking that receptor site, they are not allowing any agonist or any lock and key to open up that receptor site and allow that feeling or result to be produced. So instead, they're blocking that action, and Narcan is an example of an antagonist. Drugs must be changed in the body chemically in order to be able to be used. 4 basic processes are involved in drug utilization in the body: absorption, distribution, metabolism, and excretion. The way that the drug enters the body and then passes into circulation to reach the part of the body it needs to effect. Absorption takes place through the processes of diffusion, filtration, and osmosis. You'll remember that these 3 mechanisms use passive transport, flowing from an area of high concentration to an area of low concentration by way of kinetic energy. Sometimes molecules must move up a gradient from an area of low concentration to an area of high concentration. Doing this would require energy, and we will use our ATP molecules. An example of this active transport mechanism is the sodium-potassium pump in the heart. When the heart contracts, the sodium-potassium pump moves sodium inside the cell and potassium outside the cell. When the heart muscle relaxes again in order to fill the heart chambers with blood, the pump moves the sodium back outside the cell and brings the potassium back inside the cell. This is one of the reasons why it's so important to check the heart rate of patients who are taking digoxin. How fast the drug is absorbed into the body through these processes will depend on how easily the drug dissolves, how the drug is introduced to the body, either by mouth or by injection, and whether there is good blood flow through the tissue where the drug is located. All drugs need to be dissolved in body fluid before they can enter tissues. The ability of the drug to dissolve is its solubility. Solubility is often controlled by the form of the drug. When your patient takes water with a tablet, it is not only helping in swallowing the pill, but also helping dissolve the drug. The route of administration will also influence absorption. In areas where blood flow through the tissues is very high, drugs are rapidly absorbed. The IV route delivers drugs directly into the bloodstream. The IM, sublingual, intranasal, and inhalation routes also have very high blood flow, and drugs given via this route will work very quickly. Distribution occurs by way of the blood and lymph systems. Once the drug has entered the body's circulation, it needs to find a way to get to the organ or tissue where it will apply its action. Some drugs are attached to tissues other than the target receptor sites. Some drugs will be stored and built up in these tissue areas, such as fats. Eventually, the buildup of this drug can be released, and this will make the effect of the drug last a long time. Once a drug is absorbed and distributed in the body transforms or alters the drug into active or inactive chemicals. This process is known as biotransformation and occurs mainly in the liver. Liver disease can impair the transformation of the inactive form of a prodrug into an active form of the drug. Much of a drug is inactivated in its first pass through the liver before it can be distributed to other parts of the body. This is one reason why oral drug dosages will be so much higher than IV drug dosages. How a drug is given can affect how much of it is needed. Genetic differences in the enzyme pathways in the liver can also explain why people respond differently to a drug. These liver enzyme pathways are known as the cytochrome P450 system, are produced by the cytochrome P450 genes, and play an important role in adverse drug reactions, or ADRs, especially when several drugs are taken at the same time or when there are drug-food interactions. Excretion is removing the waste products from the body. Fibrous or insoluble waste is usually passed through the GI tract and excreted as feces. Chemicals that can be made water-soluble are dissolved and filters out as they pass through the kidneys and are then lost in the urine. If a patient has poorly functioning kidneys, water-soluble metabolites can build up in the body and become toxic if they cannot be excreted in the urine. This is one reason why it's so important for you to monitor the urine function of very ill patients. When you understand how drugs are used in the body, you will be better to identify when patients have toxic or ill effects of drugs on the body. Look on page 30 and notice figures 3.4. It explains the processes of absorption, distribution, metabolism, and excretion. It would definitely be worth your while to take a look at that diagram and study it a little bit, because it will really go a long way with helping with your drug administration knowledge. The standard method of describing how long it takes to metabolize and excrete a drug is called a half-life, or the time that it takes for 50% of the drug to be removed from the body. The half-life helps explain the dose, how much of the drug should be taken, the frequency, or how often it should be taken, and the duration, which is how long the drug will last in the body. For this reason, drugs are typically often dosed based on kidney and liver function, which is why blood work can be drawn for kidney and liver function tests. With each patient, giving a drug is somewhat of an experiment, so watching patients closely to monitor their reaction to the drug is a very important role of the nurse. Of course, we want to achieve the expected response of the drug, which is the desired action. This is when the drug does what it is desired and the therapeutic goal is reached. Side effects are typically seen as mild but annoying responses to a drug. Side effects are expected effects. Expected side effects that are very common are usually related to the GI system and include nausea, constipation, and diarrhea. Adverse effects imply more severe symptoms or problems that develop because of the drug. Some adverse effects can require the patient to be hospitalized and may even be life-threatening. These can cause damages such as nephrotoxic drugs, which will damage the kidneys, and hepatotoxic drugs, which damage the liver. Occasionally, a patient will have a strange drug reaction that is a surprise. It will be strange, unique, peculiar, and unpredicted response, known as an idiosyncratic response. These reactions may be the result of missing or defective metabolic enzymes caused by a genetic or hormonal variation in that individual. These types of reactions are usually very rare. A second type of unexpected reaction is an increased reaction to the drug, which is known as an hypersensitivity, or a sensitivity caused by an antibody response to a drug, known as an allergy. Some drugs, like sulfa drugs, aspirin, and penicillin, and some conditions like asthma, are more likely to produce allergic reactions than others. Allergic reactions usually occur when an individual has taken a drug and the body develops antibodies to it. When the patient takes the drug again, the antigen-antibody reaction produces hives, rash, itching, and swelling of the skin. This type of allergic reaction is very common, so be sure to ask all your patients about whether or not they have ever had that drug reaction. Occasionally, an allergic reaction is so severe that the patient has trouble breathing and the heart may stop. This is known as a life-threatening anaphylactic reaction. The patient may suffer severe breathing problems, including swelling of the lips, throat, trachea, and prevent air from entering the lungs. Patients often confuse an allergy with side effects, both of which can produce unpleasant symptoms. If a patient reports an allergy to a drug, be sure to ask the right questions to understand their exact past reaction to that drug. Brand name drugs are usually more expensive than generic drugs because the maker of the brand name drug is attempting to recover the huge sums of money spent on research and drug development. Generic products are often less expensive because they do not face those costs. Sometimes the pharmacy will provide a bioequivalent to you, which is a generic equivalent product that is chemically the same or identical to the brand name product that has been prescribed. When one drug changes the action of another drug, a drug interaction has occurred. The actions of a number of drugs can be altered when they are taken with other drugs. Some drugs are given together on purpose because the combination produces an additive effect. These drugs will work as a team. For example, probenecid is given with penicillin to increase the amount of penicillin that is absorbed. This is called an additive effect. Other drug interactions can produce adverse effects. For example, many antibiotics make birth control tablets less effective, and this may make it more likely for a woman to get pregnant if she is sexually active while taking both drugs. Sometimes incompatibility will occur when drugs do not mix well chemically. Attempts to mix them together, especially in a syringe or IV solution, can cause chemical reactions so that neither of the drugs can be given. The risk for drug interaction with food or alcohol is high because all of these products go through the liver. Information that every patient should know about possible drug interactions includes cigarette smoking can decrease the effect of drugs or create problems with some drugs by increasing their metabolism. Caffeine, which is found in coffee, tea, some soft drinks, chocolate, and some drugs, can also affect the action of some drugs. Drugs should never be taken during pregnancy or by a patient trying to get pregnant without the advice of a healthcare provider. If the patient has any problem related to the drugs, the healthcare provider or a pharmacist should be contacted immediately. Some drugs are blocked from being absorbed by the body by grapefruit juice, fatty meals, milk products, and other drugs. The amount of alcohol use is very high in the United States population. It has been estimated that approximately 70% of adults consume alcohol at least occasionally. Narcotics, anti-anxiety agents, antidepressants, antihistamines, antihypertensive agents, and antibiotics are just a few of the drugs that will cause problems when combined with alcohol. All drug therapy requires adequate hydration and blood flow for drugs to be distributed to target tissues. Therefore, any problem that interferes with blood flow decreases drug effectiveness. Opioid drugs for pain are metabolized and eliminated much faster in a person who drinks alcohol on a daily basis, so the dose may need to be higher for that person to obtain pain relief. Any person who has problems involving the liver or kidneys will retain a drug for much longer time, increasing their risk of adverse or toxic effects. Body size and lean to fat ratios will also affect drug therapy responses. For many people, and for many drugs, bigger people or bigger children require larger dosages. Ethnicity and genetic makeup can change the expected drug response. For example, many people of Asian descent have a greater than usual response to the anticoagulant drug warfarin, which greatly increases their risk for excessive bleeding, hemorrhage, and stroke. There is great variation in the activity of the P450 system enzymes from one person to the next as a result of genetic differences. One size does not fit all when it comes to drug therapy. In neonates that are less than 1 month of age, oral drugs are absorbed poorly from the GI tract because there is no gastric acid present to help break down the drugs. No intestinal bacteria or enzyme function is present to metabolize the drug, and the time that it takes for the drug to move through the stomach and the intestines is very slow. There is more rapid absorption from the deltoid muscle when giving an IM injection to an infant or neonate than there is in the vastus lateralis muscle, and the slowest absorption will come from the gluteal or buttock muscle. In neonates and young infants, prodrugs, which are drugs that need to be metabolized before they become active, are slower to be activated and slower to become effective. Older adults and young children have higher metabolic rates and a rapid turnover of body water. This will often result in greater drug dosage requirements per kilogram of body weight than in the adolescent or adult. During adolescent growth spurts, metabolism increases along with body weight. Drug dosages often must be increased at this time, especially for drugs that control seizure disorders. Preterm infants, neonates, and infants younger than 6 months may have less mature kidneys that cannot excrete drugs effectively. Carefully monitoring their responses and blood drug levels will be needed to determine the most effective dosages and scheduling of drug therapy. Many older adults with chronic illnesses take drugs daily. Adverse reactions are very common in older adults, and issues such as falls, hypotension, delirium, kidney failure, and bleeding are common clinical manifestations. Because many older adult patients take several drugs, interactions among these different drugs can cause problems for them. These patients may see several specialists, each of whom may prescribe different drugs. This is known as polypharmacy. The older adult patient may also become dehydrated easily, and this can allow the amount of drug in their blood to increase. There may be some delay in the absorption process with our elderly adults, and there is a decline in total body water and lean body mass with aging that results in less movement or distribution of water-soluble drugs into some tissues. Overall, there is a decrease in liver mass that occurs with age, along with a reduction in liver blood flow. When blood flow is reduced, less of the drug is metabolized, so increased amounts of the active form can remain in the blood. These factors can result in a loss of the liver's ability to handle all the different chemicals that it needs to process. In this situation, the patient may have more risk for adverse effects when drugs are added to the existing treatment plan. Kidney function is an important factor that causes adverse reactions. The creatinine clearance rate is an estimated measure of how well the kidney is functioning. This rate decreases with age, which allows the drugs to remain in the older adult system longer, increasing their risk for adverse and toxic effects. Drugs that depend on the kidneys for elimination include many antibiotics, some antiviral drugs, anti-cancer drugs, antifungals, analgesics, and many cardiac drugs. Many older adults will require special teaching about how to take their prescription drugs and the dangers of taking non-prescription drugs at the same time. In pregnancy, the drug is going to affect 2 people, so how the drug can affect the growing fetus is a big consideration. The benefit of any drug to a pregnant patient must be carefully weighed against the possible or potential risk to the fetus. Tetragenic drugs are likely to cause malformations or damage in the embryo or fetus. Many drugs have been confirmed as tetragenic in humans. As the fetus grows, the placenta will allow most drugs and foods to cross from the mother to the baby. Many drugs can pass into human breast milk as well, and this is also a major concern for the baby. The golden rule of drug administration is to never give a patient a drug that you are not fully familiar with. A drug card should include both the trade and generic names of the drug, the dosage range, the desired action, expected side effects, adverse effects, how to give the drug, and lastly, important information that you will need to know before giving the drug. Be sure to see page 36 and table 3.1. It has some common generic drug prefixes and suffixes that will be helpful to use when you're studying. Moving on to chapter 4. Now this one is a lot of calculations, which we'll be doing in class, and I expect you to do a lot of at home in practice. So this one may be a little shorter. Calculating drug dosages. It's very important for nurses to understand how to accurately calculate the drug dosage using basic mathematical formulas. To do this, we utilize the metric system to convert one unit of measurement to another. If you need a review of basic mathematics associated with drug calculations, be sure to read this chapter carefully and then use the Student Study Guide or Evolve resources to practice fractions, percentages, proportions, and ratios. One way that we can solve our drug dosage problems is using the fraction method. You would set up a fraction showing the number of units to be given as the numerator and the unknown number of tablets or milliliters to give x as the denominator. Then on the other side of the equation, you write a fraction showing the amount of drug in each tablet as listed on the drug label. You want to have the same units of measure in both numerators and the same units of measure in both denominators, and then you solve for x by multiplying across the diagonal. That's the fraction method. You can also use the ratio and proportion method. Proportions will describe the relationship between two sets of numbers. When using the ratio method, first write the amount of drug to be given using the quantity of the dosage, or x, as a ratio. Next, complete the equation by forming a second ratio, consisting of the number of units of the drug in the dosage form and the quantity of that dosage form as taken from the bottle. Then solve for x to determine the dose. You can also use the dimensional analysis method, which is personally the method that I use. But really, the best way to approach these types of concepts and problems is to try a couple different methods. So maybe try your first problem with the fraction method. Then you can try the 1/2 method. Then maybe you can try the ratio and proportion, and then maybe try dimensional analysis. See which way feels most right to you, and then continue to use that method. Once you find something that works for you, stick with it. Do not jump in between the different methods. Just find one way that works for you and stick with it. Don't let your peers influence your thinking. If you're, studying with your study buddy and your study buddy likes to use ratio and proportion, but your full-scale dimensional analysis, do not study this concept together. It will only confuse you. Just use what works for you. Basically, put your blinders on, block out everybody else, and just stick with the method that works for you. Because once you start mixing and mashing with the different methods and the different calculation strategies, that's when you're going to start getting into some trouble and start confusing yourself. So dimensional analysis is a technique that you can use instead of ratio and proportion. It is often used to convert one set of measurement units to another set by using conversion factors in a way that you cancel out your unwanted units. And you can see a great example of that on page 41, and we're also going to be doing examples of this in class. Insulin is an example of a parenteral drug that is not given by milligrams, but instead given by units. The preparation and calculation of insulin dosages is unique in 3 ways. There are many kinds of insulin, including short and long-acting forms. All types of insulin will come in a standardized measure called an insulin unit. Insulin should be drawn up in a special insulin syringe that is marked or calibrated in units. The insulin order, the insulin bottle, and the insulin as drawn up should always be rechecked by another nurse for, maximum accuracy before the insulin is given. Sometimes the provider will order 2 different types of insulin, and occasionally they can be given at the same time in the same syringe. Make sure that you never mix Lantus or Levemir insulin with any other insulin preparation. Lantus and Levemir should never be mixed with anything else. Drug administration errors can, of course, lead to patient harm. Although children's dosages were once frequently calculated, there now remain only a few that will require the nurse to actually determine how much to give to the child. We can use Clark's rule, and this rule is used to calculate drug dosages for children 2 to 17 years of age. And you can see Clark's rule on page 443. You can also use the body surface area. This is the most accurate method for determining the pediatric dosage. Drugs can be given through the intravenous or IV route, which will deliver the drug directly into the circulatory system through a vein. IV therapy can be used to correct dehydration in a patient or to give drugs directly and immediately into the bloodstream. An IV fluid administration order will have several components: the specific amount IV fluid to be infused, the amount or volume of fluid to be infused, the duration of time for which the IV fluid should be infused, and the rate or how fast the IV should be infused. The diameter of the IV tubing will determine the flow rate of the IV. Regulating the IV infusion rate is a common nursing responsibility, and all nurses need to learn how to calculate infusion rates without relying on equipment in case of a power or equipment failure, or when working in agencies when there are no automatic pumps available. A completed IV infusion order specifies not only the type of solution and the volume to be infused, but also the duration over which the total volume of IV is to be infused. The drop factor is the number of drops per milliliter of liquid and is determined by the size of the drops. After you know the drop factor for the equipment being used, you can calculate the flow rate by using the following formula. You can see the formula at the bottom of page 443. The healthcare provider can include limits in the original order that they use, and you can use your nursing judgment to hold or not give a certain drug until you clarify that order with the prescriber. You want to use the following steps as a general guide for giving drugs to your patient. The 9 rights of drug administration: minimize any interruptions or distractions while preparing your drugs. Wash your hands to avoid contamination of the drugs. Assemble necessary equipment such as medication cups and water for swallowing drugs. Follow the written drug order. Compare that order with the MAR and the drug label. Accurately identify your patient before giving any drugs by using 2 identifiers. Use the barcode administration drug system to scan the patient's wristband and confirm the correct dose, drug, and route are given to the correct patient. Do not unwrap or remove the drug from the container until you are actually with the patient. Follow aseptic technique for any oral drugs by not touching the drug or the inside of the drug container. Follow sterile technique when handling any needles or syringes or for giving subcutaneous, IM, or IV drugs. Enteral drugs can be given by the oral route, nasogastric, or rectal route. The most common way of giving drugs is by the oral route. Before you give oral drugs, you need to make sure that the patient can swallow any drug given. All oral drugs should be brought to the patient's bedside, unwrapped or in the original container. It can be placed in a paper cup using aseptic technique before giving the drug. Do not crush tablets or break capsules. If a patient has had difficulty swallowing the drug, have them first take a few sips of water before placing the drug in the back of their mouth and then follow with more water. You are responsible for making sure your patient takes all drugs safely and on schedule. Liquids or solutions must be shaken before they are poured to ensure that the drug is evenly distributed throughout the liquid. Hold the medication cup at eye level to read the proper dose. Do not dilute a liquid drug unless ordered to do so by a prescriber. Patients who cannot swallow, are nauseated, or have a bowel obstruction may not be able to take drugs PO and may have to take them through an NG tube or PEG tube. As with any oral drug administration method, always check with your pharmacist before crushing or opening any capsules. Double check the prescriber's order to make sure that you are giving the drug by the correct route, because all non-liquid drugs will need to be crushed and capsules opened before they are given through an NG or PEG tube. For NG drug administration, check that the NG tube is in the stomach. Aspirate or remove stomach contents with a syringe and then test the pH of the stomach contents. If the pH is 0 to 5, then the tube is most likely in the stomach. Auscultation over area of the stomach and listening for a whooshing sound is no longer considered a reliable way to test the NG tube placement. Irrigate the button of the NG tube with sterile water or normal saline after the drugs have been administered, and make sure to clean the area according to your institution policy. Always rinse your tube with sterile water or sodium chloride before and after you give your drugs. Drugs given parenterally are given for the following reasons. They cannot take the drug orally, they need a drug that can act quickly, the drug needed may be destroyed by gastric enzymes, a steady blood level of the drug is needed, and the drug is not available in an oral form. When giving parenteral drugs, it is important that you do not recap needles, that you dispose of them properly in a designated sharps container to prevent any needle stick injury. Basic equipment that we use is syringes, which come in a variety of sizes and is made up of 3 parts. The tip is the portion that holds the needle. The needle screws onto the tip and it fits tightly so that it does not fall off. The barrel is the container for the drug, and the plunger is the inner portion that fits into the barrel of the syringe. The needle is made up of the hub, which attaches to the syringe, the shaft, which is the hollow part through which the drug passes, and the pointed or bevel tip, which pierces the skin. When withdrawing medication from a vial, you always want to insert the needle bevel up. And you can see these figures in your book on page 51 and 52 for how you would withdraw medications from a mix-a-vial, from a vial, from an ampule. And we're going to go over these more in depth as well when we practice these skills in the skills lab later on, and then of course in clinical. And so the rest of this PowerPoint, we're going to be studying when we do these skills and throughout clinical. So, but the dosage and calculation part is the most important for what we're going to be preparing for this week, which is our dosage and calc exam. So please be sure to utilize the resources provided to you for your dosage and calc exam. Utilize your ATI resources for questions, utilize your Evolve books, utilize all the additional resources that I provided on there for you, and you will be successful on your dosage and calc exam. And thank you so much for joining in for this lecture.